Good morning, students. Shall we start about this? Today's class is the biomechanics. That is a design thinking model approaches for the biomechanics class. Okay. First is the empathize part. What is empathize? Or empathize means problem statement. Okay. That is understand the how patient move with interact with the gravity and resistance. Okay. Observe the postural problem and mobility limitation in the real life context. Okay, that is the empathy problem. Because a patient is how to move the gravity resistance field. That is the first. Then is the observe the postural problem, how to mobility limitation of the real life context. That is a empathize. Then you will go for define. And define the problem is the patient how mechanical insufficiency in the movement or posture. Okay. Then goal is the identify the principles of mechanics and the biomechanics that influence the motion. Okay. That's the goal is the identify the principles of mechanics and biomechanics that influence the motion. Then you will go for ideate. What is the ideate process? Then you will brainstorm process. Then how physics and mechanical law apply to human body. How the physics that mechanical law is applied to the human body. That is, discuss the real world example: walking, lifting, sitting, and balance. That these are the activities mainly for applied to the physics laws. Okay, in the walking position, then the walking position, the how to physics apply for the auxiliary force, the gravity dependent auxiliary forces will apply on the walking position. The lifting is for any the gravitational forces are lifted to the every body. Okay, that is a Newton losses apply to these positions. Okay, balance is a seesaw. Every action to equal to opposite reactions and Newton inertia. These are all of the laws of the apply to the this process of the these activities. Then prototype. What is a prototype? Develop the physical and visual mode. Develop the physical and visual mode. For example, lever system, torque demos to show the biomechanical movement. Then test. Or the test is apply the mechanical concept on the patient. Apply the mechanical concept on the patients to analyze the motion and evaluate the performance for improvement. Okay. Then we will go for introduction to mechanics. The mechanics is the study of motion and force. Mechanics is the study of motion and force. The two main division, statics and dynamic. What is the static? Study on the body's at rest, that is the static. Dynamic is the study on the body's in the motion or movement. Then branches of mechanics, the static is the balance and equilibrium. The kinematics is the motion description, speed, velocity and acceleration. Then kinetics is the study of force during producing the motion. Then what is the biomechanics? Application of mechanical principles to biological system. Mechanical principles to biological system that helps to do understanding that how force act on the human body. How force act on the human body. Then importance of the biomechanics helps in the injury prevention. That improves the posture improvement. That enhances the rehabilitation outcome. Then optimize the exercise and ergonomic design. Then mechanical principles in the human body, lever system. Lever system is example for bones and joints. Then center of gravity. Then base of support. Then equilibrium. Then torque and stability. Then static and dynamic concept. What is the static? The maintaining the balance in the standing position. What is the dynamic? The movement during the walking or lifting. Then our force and motion. What is the force? The push or pull the object that causes a movement change in the motion. That is a force. Motion occurs the forces are unbalanced. When the forces are unbalanced, that is a motion. Then clinical relevance. What is the clinical relevance? Biomechanics guides physiotherapy treatment planning. Okay, improve gait analysis, improve posture corrections, then strengthening protocol. These are the criteria is useful for the biomechanical. Then what summary about this class or the mechanics plus biology. Mechanics plus biology, there is a biomechanics. Well, what are the mechanical factor is implement of the biology structure that is combined to called as a biomechanics. But focus on the force, motion and balance and stability. Then foundation for the understanding human movement. Foundation for understanding the human movement. The learning outcome. In this class, what are the learning outcome? After this lesson, students should be able to explain mechanics and biomechanics. Okay. Then differentiate the static, dynamics and kinetics. Okay. Apply mechanical laws to human movement. Class questions. Okay. First, define mechanics and biomechanics. Second question, difference between statics and dynamics. Explain the role of biomechanics in the physical therapy practice. Mention any two branches in the mechanics with the examples. Okay. These are the questions. Tomorrow will write about any A4 sheets. Submit the answer sheet. Okay. Thank you.